Can low levels of vitamin D cause fatigue and muscle weakness? The short answer is yes, but before you run out and buy some supplements, watch the rest of this video because high levels of vitamin D has its risks too. While we oftentimes think of vitamin D in terms of bone health, vitamin D is important for almost every function in the body. So yes, vitamin D is important, but people with normal levels of vitamin D certainly don't need to take supplements. The first thing you want to do is get your vitamin D level checked. Just ask your primary medical professional to do a simple blood test. Labs may differ, but generally, values between 30 and 50 nanograms per milliliter are recommended. Realize that fatigue and muscle weakness are typically only seen with very low levels. Why so many? To understand why it's so common, realize we get vitamin D from both food and sunlight. It's difficult to get enough vitamin D from foods alone unless you eat a lot of fatty fish. These are the top 4 foods rich in vitamin D, and most of the foods we eat contain way less than the amount shown here. Most of our vitamin D comes from sunlight. It's produced in the body when ultraviolet B rays from the sunlight strike uncovered skin and then trigger the vitamin D synthesis in the body. Some experts suggest you can synthesize adequate vitamin D with 15 to 30 minutes of outside sun exposure on your face, arms, and legs at least twice a week, which of course is difficult to do during the colder months. Even in the warmer months, we tend to apply sunscreen, which blocks the rays that produce vitamin D. And realize I'm not suggesting you stop using sunscreen, since UV exposure is the most preventable cause of skin cancer. Add to that the fact that older people, people with dark skin, and people with obesity also have difficulties producing vitamin D from sunlight. And certain medications can interfere with vitamin D production, including statins and steroids. So if your vitamin D levels are deficient and you can't get enough vitamin D from foods or from sunlight, you might need supplements. If your levels are found to be low, the standard prescription for adults is 50,000 IU's vitamin D to be taken once a week for 8 weeks, followed by a recheck of your serum levels. Once your vitamin D levels rise back within the normal range, realize they're going to fall again if you go back to your previous lifestyle. So you'll likely need to take a supplement on a regular basis. How much? Well, it's difficult to say, but many of my clients have found that taking 1,000 to 2,000 IU's a day keeps their vitamin D levels within the normal range. Well, there's 2 things to look for in the label. At the store, you'll find both D2 and D3 supplements. While D3 increases serum vitamin D levels to a greater extent and maintains these higher levels longer than D2, either one of them will do the trick. Second, look for products that display a seal of quality assurance. Both the USP and the NSF logo on the label indicates that the product was properly manufactured, contains the ingredients listed on the label, and does not contain harmful levels of contaminants. Consumer Lab also does testing. The bottom line is that maintaining normal serum levels of vitamin D are recommended for overall health. But since high serum levels of vitamin D can have negative consequences, don't take supplements without first checking with your medical professional and then checking your blood values regularly. When selecting supplements, choose ones that have been tested for quality and safety. And finally, because vitamin D is a fat-soluble vitamin, you'll want to take that supplement with a meal containing fat.